I am not a medical professional. The following information is for educational and informational purposes only and does not constitute professional medical advice. Please seek professional training on how to stop bleeding. Hello, this class is going to cover how to apply a tourniquet and how to treat for shock. Two different subjects, but they go hand in hand, and I'll explain why when I get into it. I want to note two things. First, I am not a trained medical professional. I trained on these tasks in the Army while I was in for 20 years. We had to do these common tasks all the time, all through the year. And a couple of those common tasks were, stop bleeding, treat for shock, apply tourniquet, apply direct pressure. And so that's my extent in it. I did actually have an injury like 20 years ago. I really got cut up pretty bad. And I just happened to have one of these Army pressure dressings on hand, and I was darn glad I did. It worked very well till I could get to the hospital. So it made me a believer in buying a few of these and having them around. I want to mention a couple things about this. This one I used in my last class, so it's no longer sterile. But the Army has these tie downs, all right, which are pretty handy. Stop the bleeding. You put it on, obviously wherever it could be, here for that matter, with these. But these tie downs are pretty handy. I won't go into that again. But you don't necessarily need tie downs. The Army has these tie downs because they expect you to stop the bleeding and then drive on with the mission, or something like that. But if you get gauze, if you just hold it there hard, a lot of pressure, right on the wound with the gauze or whatever cloth you have. Now, there's another item out. It's been out not too long. It's called hemostatic gauze. And it's gauze, but it's treated with something that stops the bleeding 5 times faster. It promotes clotting, and the military uses these, and so do a lot of other agencies. And the only place I could find them is online. And so look into hemostatic dressings and gauze for your first aid knife throwing kit. The only time you wouldn't use a hemostatic gauze is if it's a head injury or a stomach injury, an abdominal injury, which could happen. So along those lines, I gotta ask you, I am not a medical professional. There's tons of information on these topics online and elsewhere at your fire department, wherever you could find it. Seek out professional training on this. If you're going to be throwing knives for life, it's better to be totally prepared in case one of these comes back the wrong way and hits you, or chances are somebody that's just standing around. Most of the time it's somebody, a bystander, that gets hit. So be prepared. Have some gauze. And if you can get the hemostatic gauze online, it's not very expensive. I suggest that. It's supposed to be really good. But there are limitations. You don't use it for a head wound or an abdominal wound. So look into that. Seek other training on this. Now, on to today's class. Apply a tourniquet and then treat for shock. I'm going to post links for professional sites that cover apply a tourniquet. I'll go into what I know. So you've got arterial bleeding. Direct pressure isn't working, or you can clearly look at it and see you've got arterial bleeding, which could be every time the heart beats, squirt, 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 you've severed an artery. And if you don't act quick, this person, could be yourself, going to bleed to death in minutes. So you've got to act quick, and you got to do something, and don't panic. You got to take action. I've seen some pretty bloody accidents, we'll say, and the sight of blood does make me a little queasy. A lot of blood. I actually had a friend who was kind of a survivalist, and he was out cutting wood with his chainsaw, and I wasn't there, but he cut himself up pretty badly with the chainsaw. And I came over, he called me, and I came over to where he was at, and he was a bloody mess. It wasn't arterial, fortunately. This guy had bought part of he was like a prepper. He bought sutures and needles, and I actually helped sew him up with sutures. It's no different than just mending a piece of torn cloth. I implored him to go to the hospital, get it done, but he wouldn't. So I had to help him out. And blood is sticky. It's sticky. It smells like blood. It's messy. It's your first reaction for some people, like myself, and some people it doesn't bother at all. It's like, eugh. Get over that. It's just blood, all right? If you've got gloves, put them on, by all means, but take action. So you come into an emergency situation. You're going to dial 911. You're going to call for help while you're going into action to put a tourniquet on. Here's some things that I wrote down. I want to cover. When it's a bona fide medical emergency, call 911. It's often difficult to stop the bleeding of a deep cut. An uncontrolled bleeding from a deep or large cut is a very serious situation. If somebody's punctured, if the knife's still stuck in them, leave it in them, particularly if it's in their torso or their head. I mean, if it's in their leg, a flesh wound, use your own discretion, but everything I've read is leave the knife in them and then just gauze around. I'm covering things from the other class. You'd wrap the gauze around the cut, trying not to move anything, of course, and calling for help. Call 911 also if you experience spurting blood. It just keeps soaking through the dressing. You put all this stuff on there and this isn't stopping it. It's soaking through. A significant amount of blood. You see there's a giant pool of blood around this person and their injury. Bleeding that is not controlled by applying direct pressure. Also a wound that penetrates the chest or abdomen. Any of them. That's a bona fide medical emergency. The cut may have affected vital organs. Call 911. And when I go out to the woods to throw knives, even making these classes, I told my son where I'm going. I drew him a little map, like a Google Earth map, and said, I'm going to be out here all day throwing knives. So if I don't come back, you know where to find me. But if I call, let somebody know. Better safe than sorry. There's no set criteria as to when to call 911 or when to call for help. If you at any time or any level think it's an emergency, call for help. Meanwhile, take action to slow or stop the bleeding. When to apply a tourniquet. If everything else fails to stop heavy bleeding, you might need to go to a tourniquet, or a person could bleed to death in minutes. Tourniquets should be used when the bleeding cannot be stopped by the use of direct pressure. Okay, call 911, go into action. Tourniquet's going to be used for arm or leg. Obviously, you're not going to put a tourniquet around your neck for a head wound. You could. Don't recommend it. So for an arm or leg, which, that's when you're going to throw a tourniquet on. So I bought these. Everything I read on tourniquets said that to buy a tourniquet, it's much better than using an improvised tourniquet. So I got these two tourniquets for $8, two of them. Well, there's another one here somewhere. Anyway, I got two for $8. I got two of that. So, they're not hard to find. Now, after I read up on these tourniquets, I read that a lot of people say don't buy these cheap ones, that they may not hold up if you actually need them. They may break because you're going to be putting a lot of force on this to tighten it. So spend a little more than $8 on your tourniquet. Buy Buy something a little more professional, something recommended. Look into it. I'll just put it there. Use your discretion. But spend a little more than that, $20, $30 for your tourniquet. You won't regret it. Hopefully it's an item that you'll never use and it just sits around in your closet until you die of old age and somebody takes it and sells it on eBay or throws it out or something because you never needed to use it. But if you do need to use it, you'll be glad you bought it and spent a little extra. So, I'm not going to take my shirt off. I'm sorry. I'm cut here where the tape is. Blood spurting out, or I've got direct pressures not stopping it. It's soaking through the bandages. I'm getting weak. I've lost a lot of blood. I've got to do something. With this store-bought one, or online bought one actually, pretty self-explanatory. You're going to want to go at least 2 inches above the wound, okay? The reason for that, you're going to go 2 inches above. If I'm cut here, I would go up pretty much my elbow, but I won't go over a joint for reasons that major arteries pass through. The joint won't allow you to constrict it enough. If an elbow joint or a knee joint or ankle, you can't constrict it. The bones will prohibit you from constricting the vessel enough. So I'm going to have to go right above in this case. But if I've severed an artery, it's like they're kind of rubbery. It's severed and the artery is it'll slip up a little bit. You know what I mean? Like rubber. The artery won't be just severed right there. It'll slip right up, maybe 2 inches up. So you want to go above that. So I go here, and I got to work quick, and I can't let the sight of blood freak me out. It'll clean up, it'll wash off. Okay, this is not always easy doing one-handed. That's why you should practice this, right? I should practice this too, quite frankly. It's all Velcro. This is one big piece of Velcro. I would have bled to death by now. Cripes. All right, so I get this really tight. All right, everything I've read, they say you want it tight enough initially so you can't put 3 fingertips underneath it. You want it really tight, tighter than what I've got it actually. And it's going to get a lot tighter. Leave this hanging out. Now you've got this. It's called a windlass. Good Lord. Yeah, I would have bled to death by now. Now, with the windlass, granted, I need to train on this myself. All right, I'm not being very fast or efficient with this, but this is what you do. Then you tighten the windlass. Crank her up, get it really tight, and one turn gets this thing pretty tight. See how hard it is for me to do this with one hand? And I practiced at this. And then, good God. I'm boloing this. All right, there it is. That's pretty darn tight. Now I probably would go another turn, even tighter, but I'm not going to because I have an arm injury here. But if I had a cut, I'd turn this thing at least one more turn, and trust me, as tight as this thing is right now, I'm pretty sure it would stop the bleeding. I'm very sure it would stop the bleeding. So these ones you buy, they've got a place where you tuck the windlass up in here to hold it in place. If you buy them, you'll see. They come with instructions. They're pretty easy. I'm pretty certain if I practice this a few times, I'd get better. I'm just giving you this for a heads up on things. Okay? Time. You write the time down because medical, they're going to want to know when you get to the hospital. I've read that your arm, you won't lose a limb just because you put a tourniquet on. Actually, I've read they can save your limb for quite a while, you know, but you're going to lose your life if you don't, quite frankly. So do the tourniquet. Don't be afraid to do it. So I got this thing really tight. The bleeding stopped. If I want to go a step further, if it's on my arm, I check my distal pressure. Actually, I don't feel anything. I think I've pretty much cut my blood flow off to my hand. I don't feel any pulse. You check your distal pressure, and I'm not getting anything. So I got it on pretty tight. At that point, then you dress this up, you know, tuck it all in, make it look neat, and go to get medical help. I don't have any pulse at all. That one turn, tighten this up enough. I don't feel any pulse whatsoever in my hand. So there's another thing about tourniquets that I just experienced now in a small level. But I've read that you need to be aware, and if you're putting one on somebody, make them aware. It's going to hurt. It's going to hurt quite a bit. The longer you leave it on, it's going to hurt. Like, that's why people are inclined to want to loosen it up to relieve the pain. I've read do not do that. Leave it on and bite the bullet, endure the pain. All right? Because it's going to hurt, but you're going to lose your life. You're going to bleed to death if you need a tourniquet and you don't put one on. So I'm telling you right now, two things. You know, it pays if you're going to be throwing knives a lot. Buy a tourniquet, a couple of tourniquets. Spend a little more than $8. So honestly, I don't see anything wrong with these. Get yourself a couple of tourniquets. They're cheap. They'll last forever, and you'll have them. And better to have them than not have them. And learn how to use them, practice them. I really haven't done this. I did this once yesterday. That's it. And the last time I did apply a tourniquet was when I was in the Army, well, quite a while ago. It's not easy to do them one-handed, honestly. If you're going to be throwing knives alone, you need to practice this stuff one-handed. If you hit an arm, if you hit a leg, obviously you can use both hands. If you hit somebody else because you're being careless, you didn't, whatever, somebody else is being careless, then you don't need to worry about that. Okay, so seek more professional help. Buy some tourniquets online. You're going to be a knife thrower. That's what knives do. They cut things and they stab things, all right? Stabbing and jabbing, slicing and dicing. That's what knives do. So you're going to be throwing you're going to be throwing these around quite a lot for quite a long time. Be prepared for accidents. Okay, so let's say you don't have a professional tourniquet. You're going to have to put one on improvised, all right? And you could use your t-shirt. They will work. They are long enough for your arm, maybe your leg. In this case, I'm going to use an old Walmart vest. Okay, so I guess we'll go with my arm again, right? I'm going to have to do this one-handed. So this time I've been cut here. Knife came back and pow, right? Just severed an artery in my forearm. And blood spurting all over the place, and pressure dressing's not doing a thing to stop it. Time to stem it with a tourniquet. So I'm going to take my improvised tourniquet, which in this case is a Walmart vest. It's what I had laying around. You know, I was in my backseat of my car, actually. I used to work there until recently. Okay. You're going to want your tourniquet. They say to have it at least 2 inches wide. That's what I've read everywhere. And I noticed that this isn't 2 inches. And most of the ones I've seen that are professional aren't 2 inches. This looks like maybe an inch and a half. But, you know, inch and a half, 2 inches wide. You don't want to use a cord. It'll damage your tissue. You don't want to use rope or wire or cord. So be advised. I don't think a belt. I tried this with my belt and I couldn't get it tight enough. So play around with this. Okay, so what I'm going to do in this case is I'm going to tie a knot 2 inches. This is the wound. I'm going to go 2 inches which is roughly 4 fingers for me. And here's a life hack for you. Take your hand and just measure out how wide different things are. It's a good way to do a quick measure, you know. That's 2 inches for me. So that's going to be right there. And that ain't going to change much throughout your life. Okay, I've got to tie a knot. I've got a pretty thick stick. A ballpoint pen, I've read, will break. By people that I've actually read up on this a lot. They said don't try to use a ballpoint pen, it will break. You're going to need something, maybe a knife, right? I'll use the knife, but in this case, I'm outdoors, I'm going to use a stick. This is going to be my windlass. I'm going to tie another knot over this. All right, now I'm going to start twisting. Ooh, that does work. That does work. That works. And just keep twisting. And it's getting pretty tight. This will work. And keep twisting. It's not as tight as the ones I bought, honestly. I think I'd have to really twist the living heck out of this to get it that tight. It's getting there though. And keep twisting. Yeah, that's pretty tight. Now, if you gotta just hold it in place and keep putting direct pressure as well. Direct pressure plus this tied in place. Usually they say tie the windlass off, you know, but if it's just me, I only have one hand, that's gonna be kind of hard to do. So hold it in place. You've called 911 before you did this, and now you're trying to stop the bleeding. So direct pressure and get this thing really tight, 2 inches above the wound, but not over my elbow or joint, or that won't work over a knee joint, elbow joint. You won't be able to constrict the arteries up inside a muscle and stuff, and you've got to constrict it. All right. Ooh, that's pretty tight. All right, you're gonna have to get it pretty tight. And right now, it's so tight it hurts. And I'll bet you I wouldn't be able to feel a pulse right now. So this will work. That will work for an improvised tourniquet. And it does hurt. But if it stops the bleeding, it stops the bleeding. And hopefully by now, help is on the way. And that's how to apply a tourniquet. With a Walmart vest or a t-shirt. A t-shirt will work. I tried it yesterday. You need to practice this. Just don't take it from me. And don't just buy the kit and just let it sit there unopened. You're going to have to practice this, because when you have an emergency, that's not the time to practice it. So learn how to use it before the emergency. Hopefully you never have one. All right, so I'm going to go into treat for shock, and that's pretty quick. There's different types of shock. If somebody could have a broken back, they go into shock, or loss of water. There's different types of shock. Either way, it can be a fatal event. It's basically somebody's dying. This one's when people lose a lot of blood. And I took some notes for this. And it's not a very lengthy class. But when somebody has been hit with a knife and they've lost a lot of blood, here it is. When somebody's lost a lot of blood, basically they've lost so much blood that their heart can't supply enough blood to all the organs like it would. And it's called hypovolemic shock. Basically, it's an emergency condition which severe blood loss makes the heart unable to pump enough blood to the body. This type of shock can cause many organs to stop working. And I took this information off a government Medline Plus site. And I'm going to put some links and information in the description where you can look to get further information on this. So don't take it from me. I'm not a medical professional. I'm just bringing this to your attention. Symptoms of shock. When somebody's going into hypovolemic shock because they've lost a lot of blood, because they had an accident with a knife. Anxiety or agitation. You know, they're starting to lose it. You know what I mean? They're cool and clammy skin because actually I read the body's going into survival mode, and it's not sending blood to the extremities now. It's just trying to keep the brain, the heart, and lungs functioning. You know, it prioritizes to try to keep you alive so you can keep throwing knives and learn from your mistake. Right? Confusion. Decreased or no urine output. All right. Generalized weaknesses. You just feel weak. Pale skin color or pallor. Rapid breathing. Sweating, moist skin. They're unconscious and they're not responsive. The greater and more rapid the blood loss, the more severe these symptoms would be. So symptoms are, I'll read them a little faster: anxiety or agitation, cool, clammy skin, confusion, decreased or no urine output, generalized weakness, pale skin color, or gray if they're dark, they're not white, Caucasian, rapid breathing, sweating, moist skin, or they're unconscious. Treatment, get medical help right away. You've already called 911. As soon as you came on the site, I had an emergency just 2 weeks ago where I came across somebody that had a heart attack. Yeah, that was freaky. I called 911. As soon as they were unresponsive, I called 911. And it was not a pretty sight. It shook me up, but I went right into action, called 911, tried to clear this person's airway and all that, and they came to, thank God. So call 911, then take action. And I can say that from experience. I just did this just a couple weeks ago. Seek medical help right away. Keep the person comfortable and warm as to avoid hypothermia. They're going to be cold. Have the person lie flat with their feet lifted 12 inches or so up, so they're flat on their back, and then prop their feet up. We used to put their feet on their army helmet in the army, but raise their feet up. And there's situations you don't put them on their back is if they have a head wound, then you sit them up. If they've got an open like stomach wound or chest wound, you don't prop their feet up. You're going to put them on their side. If a knife sticks in their chest, that's an open chest wound, and you're going to lay them on their side in like the fetal position because you're going to put them on the side. If they're punctured here, lay me on that side so this lung doesn't fill up with blood. At least have one lung that's not filling up with blood, hopefully. So if they have if it's stuck them in the gut, don't put them don't raise their feet. But if somebody has a knife stuck in their chest where it's through a lung, put them on their side. You know, if the knife's in this side of me, lay me on this side. Leave the knife in. Don't pull it out. Lay me on my side so that the side that's good can still function. Although this side is going to be full of blood, they can fix that at the hospital. You just want to keep them alive long enough to get them to the hospital. They're going to die, probably. Maybe not. So put them on their back, lift the feet, unless they have a head wound or an open chest wound or an abdominal wound. However, if the person has a head, neck, back, or leg injury, if they got a leg injury too, do not change the person's position unless they're in immediate danger. Usually like a combat environment, you know, you got to do what you got to do to get them out of the threat or if they're laying in the middle of a road. But this is knife throwing, all right? Immediate danger. People are still throwing knives around them. Stop throwing knives. I've got a medical emergency here. Call 911, and I'm going into action to try to keep this person alive. Do not give fluids by mouth. If a person is having an allergic reaction, all right, that's another type of shock, like a bee sting or something. If the person must be carried, try to keep them flat with their head down, feet lifted. Stabilize the head and neck before moving a person if they have, all right, suspected spinal injury. The goal of hospital treatment is to replace that blood. So, all right, I copied that off that government site. But I read a lot of other things, and from my training in the Army, you basically, you put something, try to make them comfortable. Don't lay them on the cold ground or wet ground if you can help it. Put something underneath them. Raise their feet so that the blood that they have left in their body is getting distributed to the organs that are going to keep them alive. They're going to say they're cold because they are, because blood's not going to their extremities anymore at this point. They've lost too much. Put a blanket or a coat over them. They're going to say they're thirsty. This says don't give them anything to drink. Again, if the knife is stuck into their chest, leave it in there. Don't pull it out. Lay them on their side, and lay them on the side where the chest injury should be closest to the ground, so that their good side is up. And keep them comfortable. Talk to them. Tell them help's on the way. I don't know, joke. I don't know if that's appropriate or not. But stay with them and just tell them, you know, hey, help's on the way. You know, we got you taken care of. You're going to be all right, you know. And that's all there is. Treat for shock. Basically, you're trying to keep a person alive. Somebody's had a major injury with a knife. In the situation of this video, you've cut an artery, and direct pressure isn't going to stop it. You tried. I was going to get into pressure points. Look into pressure points. I'm not going to even cover that. I couldn't find much on it. But direct pressure isn't going to stop it. So you had to apply a tourniquet, either with your Walmart vest, your t-shirt, or hopefully something professional. These are much, much better. And it's only like $10 or $20 to buy a couple. Please do if you're going to throw knives. And have them with you somewhere. That's it. Please read up on this and become as good as you can on how to stop bleeding in the event that you have a medical emergency throwing knives. And I know of three instances in my life of knife throwing where people were hurt badly throwing knives. One person lost his life. The other two, guy, I told you these stories every time. The guy got stabbed in basically his butt cheek by a bounce back, and he wasn't even, just somebody got careless. And another one was a guy had a bounce back, and it went right through his son's shoe and cut his foot right open badly, that he had to go to the ER emergency room. These things, when they come back, if they come back point first, your clothes isn't going to slow them down. They're going to come right through, and they're going to cut through your clothes, they're going to cut through your skin, and they're going to cut vessels and possibly an artery. If you're careful, this shouldn't happen. But accidents can happen to the best of us. So be prepared. And I implore you to buy a professional tourniquet. Have one in your car. You may need it to use it on yourself in the car, a car accident, or somebody that you're riding with, or you may come across an accident where somebody's bleeding out. People can bleed out in minutes. And throwing one of these on them 2 inches above the wound could save their life. Don't worry about getting it wrong. You do something. Getting it wrong is doing nothing or freaking out. You call for help, and then you go into action. You can't, the only way you could get it wrong is to do nothing. So I've read again that, you know, if you put a tourniquet on, doesn't mean they're going to lose that limb from the loss of the blood flow. They can pretty much, you get them to the hospital within an hour or so I read up to 2 hours, and they can save your limb, but I don't know that. I guess it depends on a lot of things. So please get yourself professional gear. Get the hemostatic gauze if you can find it online, and read up on how to use it. The only thing, if you use hemostatic gauze like they use in the military, I read, will stop bleeding like 5 times faster, but it takes a medical professional to remove it. But the idea is just to stop the bleeding till they get to a medical professional and let them know you used a hemostatic gauze. Or one of these, pressure dressing this is called, or gauze, whatever you can get. Sterile, clean, soak up a lot of pressure, a great deal of pressure. Don't be afraid to get your hands dirty. This topic can go even deeper, like where people say you can even reach inside the wound to stop the bleeding and find the vessel, but I'm not going to get into that. That's a different level. All right, I'll put a little information at the end of this video, or a lot actually, to cover things. Thank you. And again, I'm just covering things that I'm telling you need to get to learn how to do. Study up on it, practice it, get the gear. It's very cheap. It can save your life or somebody else's. All right, that's it. Dismissed. Arterial bleeding. Blood comes from an artery. Blood is bright red in color. Blood comes in jets, and it corresponds to heartbeat. Blood loss is rapid and profuse and can cause death quickly. A word on hemostatic dressings and gauze. These are gauze and dressings treated with hemostatic blood-stopping agents. They use to promote and hasten clotting to stop bleeding of severe wounds of the limbs, shoulders, and hips. Hemostatic dressings should not be used in wounds of the abdomen, chest, or open skull fractures. This is a developing technology used by military and paramedics. I have never used them, so at this time I can only recommend doing research into hemostatic dressings and possibly consider them in your knife throwing first aid kit. They are readily available for purchase online. Do the research first. Applying a tourniquet. Call 911. Go into action. Remove clothing and expose the wound. Apply tourniquet 2 to 4 inches above the wound. Do not apply over a joint. Apply above. Tourniquet can be applied over clothes. Tighten windlass until bleeding stops. Secure tourniquet or hold. Note the time for first responders. Treat for shock for blood loss. Call 911 or for help. Then stop the bleeding. Lay the person down and elevate the feet 12 inches unless it's a head wound or chest wound. If a head wound, sit them up. If a chest wound, lay them on the side with the injured side closest to the ground. With the injured side closest to the ground. Keep them warm. Follow up. Talk to them. Finally, again, I have to say, I am not a medical professional. Please seek out professional sources on all the topics covered in this and my other classes on first aid for knife throwers. Also, invest in the Stop Bleeding gear and learn how to use it. Practice with it. All right, that's all I got to say. This is about as far as I can cover these topics, so get good at this, just like you're going to get good at throwing knives. Thank you.